Okay, good afternoon, everybody. I'm going to call this meeting to order. This is a City Commission emergency meeting that was called by me late last night. We simply need an adoption of the agenda. There's one item on the agenda, public health and safety response to the coronavirus. Is there a motion to adopt the agenda?
Second.
Motion and a second. Any members of the public wish to speak to the motion? All in favor say aye.
Aye.
All opposed? Y'all are participating. So things might look a little bit different. At the advice of the medical community, they urged us to model the distancing behavior that is being requested by the Center for Disease Control. That means that we should be keeping a minimum 6-foot distance from one another. For 6 foot, that is typically an average human wingspan with a few extra fingers added on the end. And so we do have most of our commission here. We were missing Commissioner Simmons. Commissioner Johnson is here some. I don't see her with us, but she should be joining us. I saw her in the back. And so the reason that we've come together today is to ask questions and raise concerns to our city staff. I will be declaring a state of emergency later after this meeting, and we want to make sure that all necessary questions are asked before that declaration of emergency reaches its final draft form and gets signed into action. I, as well as many of my colleagues and city staff, have been fielding a wide diversity of questions with concerns over this pandemic. And what we can do on a local level to address it and what is being done at the state and federal level to address it. We have been asked about our ability to institute a curfew. We have gotten many concerned calls about large gatherings. There was a gathering of over 600 students at a pool party. There have been bars that have been overflowing with customers in the past couple days, which create ideal vectors for the spread of the coronavirus. We have been asked about our ability to disallow congregations of people of 50 or more. That is the current advice from the Center for Disease Control, that all public gatherings of 50 people or more be stopped. I've gotten some questions about our public hearings in general, what this does to different petitions that have been heard. I've gotten many questions about food distribution, how we will continue to make sure that our most vulnerable citizens are able to get food. We have gotten many questions about suspending evictions and violations for late payment of rent, mortgages, or other business costs. We have asked what we can do at a local level to help facilitate small business support. And we've gotten some questions about the election tomorrow, and we do have an update from the Supervisor of Elections on that. So those are some of the big ones that we have been hearing about that we'll ask to be addressed. I'm going to recognize our clerk, and then I'm going to ask our city attorney to come up, because I think it's important to understand what a declaration of emergency is and is not, and understand what will happen within the parameters of that declaration of emergency, including who's responsible for specific powers and actions. Madam Clerk? That wasn't you? Oh, it was inadvertent. Very good. Okay, City Attorney. Ms. Shalley, welcome. Can you please speak to us about what we're talking about when we say declaration of emergency and sort of where the boundaries of that are?
Yes, thank you, Mayor and members of the Commission. Under both Florida statutes and the City Charter and the City Code, it provides the mechanism by which the mayor, or in the mayor's absence, the mayor pro tem, is authorized to issue declarations of emergency during periods of natural weather disasters, pandemics, etc. So in the declaration that we have prepared, it enumerates certain broad authorities that are then granted to the city manager and to the general manager for utilities in their respective areas to take certain actions, particularly in this kind of an emergency, which is very fluid. Conditions are changing rapidly. It will be incumbent upon the two of them, and pursuant to the authority granted in the declaration, for them to then issue their own orders setting forth further things as the situation unfolds and emerges. So it's not necessary for this body to reconvene to take those actions. As I said, the authority is vested in you. Under Florida law, those declarations of emergency are good for a period of 7 days, after which they can then be re-upped. They can be, of course, changed at any time if conditions change accordingly.
Yeah, thank you. So, I think what we'd like to do is hear from the city manager and the general manager for the utility, kind of laying out what broad requests they're making in the declaration of an emergency. Then we can field questions from members of the commission. If there are things that are absent from there that you would like some answers to why they are missing, or if there are things in there that you have concerns about, they can speak to those as well. So, Mr. Feldman?
Thank you, Mr. Mayor, members of the commission. Lee Feldman, City Manager. So we have pretty much a standard local determination of emergency declaration of, in this case, a pandemic emergency. We will be asking that all the powers that are normally granted pursuant to Chapter 252 of the Florida statutes be enumerated in here. Specifically, the declaration will suspend Article 8.3 of the agreement with the IAFF, the International Association of Firefighters, which requires declaration to suspend that. It would give me the authority to act under Florida statute section 252.38 in dealing with this emergency. I would be the individual designated and authorized to enact and rescind curfews or limit assemblies within the city. It would also allow me to take any and all actions under our current emergency operations plan in order to protect the health, safety, and welfare of our community. It would designate myself or Mr. Bilarski, our general manager for the utilities, as appropriate to suspend labor agreements with the city. And it would also designate myself and Mr. Bilarski to waive the policies, procedures, and formalities otherwise required by the city pertaining to the performance of public work, and to take whatever action that is necessary to ensure the health, safety, and welfare of the city. Suspend procedures for entering into contracts, incurring obligations with regard to human resource policies, rental of equipment, acquisition and distribution with or without compensation of supplies, materials, and facilities, and to appropriate and expend public funds. This emergency declaration, as Ms. Shelley said, would be in effect for 7 days and then would have to be renewed.
Yeah, and I think the idea with that 7-day period is that things change rapidly, and so if scope needs to be broadened, we have an opportunity to do that. We're also going to hopefully get some support from the state and federal level, and we'll need to be responsive to that as well. I'm hoping and would expect some more aggressive action to be coming from our state government and hopefully our federal government as well. Mr. Feldman, something to add?
If this is the proper time, I can also go into specifics as to what I would be doing under the declaration in terms of restrictions within the community.
Yeah, please do.
So, recognizing that we are currently at the prevention stage, hopefully we don't get to a point of mitigation and we can prevent the COVID-19. Starting to look, following the CDC's guidance of limiting groups to 50 or under, putting the following restrictions into place. And wording is still being worked on, so this isn't the final wording, but all places of public assembly, indoor and outdoor, will be limited to occupancy to 50 people or 50% of the occupancy load, whichever is less. So if you only have a occupancy for 30, the most you'd be able to have is 15. This would exclude pharmacies, grocery stores, convenience stores, private offices, banks, hotels, hospitals, airports, bus stations, and a whole series of businesses which we consider to be essential businesses for the operation of society in terms of getting basic needs met. In addition, business establishments that serve food and beverages would be limited to table seating only. Table seating would be limited to 6 individuals or less. There would be no bar stool seating. There would be no opportunity to stand and drink beverages or stand and eat food. Basically, you would have to be seated at a table, and those tables would have to be limited to 6 individuals or less in size. Each table, we're hoping, and again, still working through this piece, would have to be equipped with some sort of hand sanitizer that's available for frequent sanitizing of hands. Hours of operations for these establishments would be limited to 6 a.m., starting 6 a.m. in the morning and ceasing operations at 9 a.m., though there would be provisions that would allow 9 p.m. that would allow for takeout and delivery services to continue beyond those hours. In addition, we are going to limit on RTS our buses to only serve 50% of capacity. So a normal bus can hold somewhere between 37 and 45 neighbors. That would be restricted to 50% of that so that there can be social distancing on the buses. Not part of this order, but just for the Commission's information, we are currently running on our spring break and summer schedule, recognizing that some of our neighbors, primarily students, are not in town.
Okay. Mr. Bolarski, did you want to talk from the GRU perspective?
Thank you, Mayor. Yeah, at GRU, we're primarily concerned at this point for continuing to provide the services that we do on a regular basis. You can't go through a pandemic without having electricity. You can't be without running water as well as wastewater services. In addition, our GRUCOM services are vital to the community as well. So as part of that, our primary focus has been a protocol surrounding keeping the employees that we have in the various positions in good working order, if you will. They are what keep all these functions going. So we have a primary water supply at our Murphy facility that's staffed with 5 folks. So we're looking at contingency plans whereby we may even do some reverse quarantining, where we've reached a point where it would be better to have those folks housed 24/7 at that water facility. We're putting into place right now as we speak, how that would be facilitated. We're also separating similar work functions in our customer service. We've reallocated some folks that typically work down at the administration building out to the EOC, so that if there's an infection in one area, it won't affect the other, so that we can still continue to operate. It's about a business continuity plan. So that's our primary concern. Within that operation, we're doing some things that are kind of obvious, but still are worth mentioning. We do a lot of group tours. We're discontinuing any of the plant group tours. We're discontinuing any of the business travel. Any of the events, we have GRU in the neighborhood. We do all kinds of things out in the community. We're discontinuing those. Any kind of group gatherings. We do some informational lunch and learn gatherings. We're not getting into situations where there'll be people in one area that will feel concerned that their personal space has been infringed upon and they don't have the social distancing that they need. Along with that, we're also foregoing most situations where we're entering our customers' homes. Now, We'll still have our gas leak service. I mean, that's vital to the community. If somebody, they should not be afraid to call if they smell gas, and they should call up our number so that can come out and be checked. But if there's some work that could be done in 30, 40, 50 days, something like that, we will defer that type of thing. So part of going out for the analysis of the LEAP program will be suspended to some future date. Some of the triggers we're looking for in the future is when do we shut down the lobby? Because that can be an area in which you have a lot of folks that are gathering. That might be the next step that we're looking at. And along with that, we're just trying to be proactive in putting our folks in a position where they can work from home and still get the work done. So we are identifying those folks now, getting them connected. Walt Banks, our Chief Information Officer, is working with Mr. Feldman on lists from folks at general government that can partake of the same measures. So we're working together to try to do that for the community.
Okay, thank you, Mr. Pilarski. Sure. And I know, good, Mr. Feldman.
I should have mentioned also, with regard to our parks and recreation programs, at this point, all of our recreation programs have been suspended. All of our sports leagues have been suspended. Our parks have been closed with the exception of the outdoor trail system that's available, so people can still come and walk around, let's say, Depot Park, though you can't use the playground equipment or the pavilion at that location. But also make sure that we're communicating this directly. The city facilities, and I believe there are 7 that are polling places tomorrow. We've told the supervisor of elections that we will reopen those for the specific purpose of using them as polling places. We will be providing them with additional supplies to sanitize the operations, and then we will close them back down.
Okay, thank you, Mr. Feldman. On that, Madam Clerk, can you update us on the statement from Ms. Barton, Supervisor of Elections?
Absolutely. We've been in communication just about every day through this event. And as Mr. Feldman stated, we have been working with them to help them get the supplies that they need to properly sanitize those polling places. There have been a couple of consolidations. Last night there was a fire, I believe, at precinct 51, but that polling in the polling room, but that polling place will remain open. Another building on the site is being identified for those voters that are affected, as well as the consolidation of precincts 23 and 61 because there were some concerns for the virus and having those facilities located those near populations that are vulnerable. All of these updates are also available on the supervisor's website for the Alachua County Supervisor of Elections. There has been a call for anyone that has already been a trained poll worker at some point to reach out to the supervisor's office as well, because most of our poll workers are part of our elderly population. To date, we've lost about 100 poll workers, but the supervisor has been able to work overtime and with community help replace just about all of those positions. So at this point, we're just continuing to look for volunteers for just contingency planning for tomorrow to get us through the end of the day.
Okay, thank you. And Dr. Chaka, do we have you on the line? Raul's coming. I thought she was with us, but perhaps not. No? Okay. She will be with us on our telephone town hall meeting on Wednesday. She's a public health professional, and we'll be able to answer some other questions and also, I think, give some good community advice, most of which involves everybody staying home, social distancing, not being out in public if you possibly can. Okay, let's take questions from members of the commission, and then we'll see if there's any folks from the public that have questions. Commissioner Ariola.
Thank you, Mr. Mayor. My questions are going to center around 2 aspects of this crisis. First is testing in our community. I understand that the EOC and the Department of Health are taking the lead on that, but my questions are going to be specific to when are we going to find out the logistics for testing, how are they going to be arriving in our community, and how are we going to be communicating appropriate testing for the virus to the community?
So I don't want to sound vague and inconclusive, but I'm going to be vague and inconclusive because we have been furnished that information.
Do we have someone from the Department of Health here who can answer
We
those
invited
questions?
somebody from the Department of Health. Dr. Myers is actually deployed to Tallahassee. We asked for them to send a representative, and they declined. And Chief Lane could talk a little bit more about the communication we had with DOH today about attending this meeting, if you'd like, but they're not here.
Yeah, Chief Lane, why don't you, whatever you do know.
Manager summarized it well. Dr. Chaco, we could get her on the phone. I think the general guidelines will be coming forth in compliance with her recommendations. The manager will be issuing emergency orders that will put in place the social distancing and certain things that will be taking place, and he can discuss that later on. Right, and so getting back to the testing DOH, that is an area that is difficult statewide. Constantly, they're changing the parameters who is eligible for a test and who would be getting a test. We've personally experienced difficulties getting tested in this community and many other communities across the state. Very high thresholds with a limited number of tests available, and then how they allocate those and how you get tested. There will be more and more tests available, as you see in the national level. They will come here, and the restrictions will go down and the eligibility will go up. As the travel becomes less and less of a germane qualification, obviously, as there's more mixing and more exposures, that will drop off the list, and they're down now to less and less of those. The short answer is, quite frankly, there's not a lot of testing going on right now. As you can see, the number of tests statewide are relatively low. That will change over the course of the next weeks as the tests become more available, become more reliable, and we get a better criteria on who needs them. In the city, we are developing our own system for testing for city employees, particularly focused at first responders, so that we have a fast lane, if you will, with Dr. Chaco's help and EHS, Environmental Health Services with the city. So we make sure anybody that has a direct exposure gets immediate tests, and we know how to deal with those circumstances.
Thank you. I appreciate that response.
Let me also tell you that I've personally talked to Dr. Myers and told him that the city will do whatever we need to do in order to assist the Department of Health. In that regard, Chief Lane is already scouting out sites, and we're starting to look at where we can do drive-through testing, if that's an option that DOH wants to do. We're starting to look at where we can potentially use sites for mass casualty and mass treatment if necessary. So we're trying to be proactive on identifying sites based upon what we think needs might be before we actually get the call asking us for sites.
Thank you. And to that point, Mr. Mayor, I just think that the city manager should include all of those items in the emergency plan. When is not a matter anymore. This is already happening. And so we need to get those logistics out to the community as quickly as possible. I was going to suggest, I'm glad to hear Chief Lane mention that our first responders need to be prioritized because their health is absolutely important to our functions. The second point that I want to bring up, Mr. Mayor, is how we're going to help our most vulnerable in the community as this crisis unfolds. First, I think we need to look at our own city employees and protecting them. I believe that in the city manager's plan, we should have all non-essential city employees work from home and identify funding sources for paid time off for those who are unable to work because of sickness. I believe that we need to be working to coordinate food and hygiene supplies for members in the community who are unable to leave their homes, either for autoimmune self-isolation reasons. I'd also like to hear from the city manager, have we considered a plan for our homeless population and how we are going to address their health in this time?
So if I can hit each one of those, with regard to our own community builders here, our employees, as I discussed at the GPC meeting, we've put in place leave policies that are extremely liberal in terms of self-reported individuals who are quarantined are not going to be charged any leave. If individuals can work at home, they are permitted to do that. We've worked with our partners at GRU in terms of increasing our bandwidth so that that our own systems can take the influx of data back and forth on there, so our employees that have the ability to work at home can, if that's what they would like to do. And then with regard to just taking leave off if they have to deal with children or other family members, or just are not comfortable coming to work, they can use their paid time off bank for that. And if they don't have enough leave, as we indicated on last Thursday, we will have a pay it forward process. For those who are temporary employees that have no leave, we will continue to pay them. If individuals are sent home because there is no work because we've closed down their facilities, if there's no other work that they can do, we will continue to pay them as well. With regard to our most vulnerable communities, we're working closely with the school board in terms of meal distribution. We've made our facilities available if they need to. There are 2 facilities that should come online tomorrow, and we will actually be providing staff to assist in the distribution of those food, including picking up the food from the school board sites, bringing it to the 2 facilities that they've asked us to stand up. With regard to the seniors, there are 2 Meals on Wheels programs, one at Cone Park, one at the Senior Center. Both of those facilities will be closed, but we've committed to, for the 25 to 50 neighbors that use those facilities, we will use our own staff to deliver the food out to those homes so that they can continue to receive the meals. In addition, we're starting to work with the food banks in the areas to see how we can assist. We've also told the county that at the time that they want to do the food distribution program countywide, we will be an active player in that and assist in any way that we can. With regard to the third point, and sir, you got to help me out on
Homelessness.
the homelessness. We have John and Helen here from Grace. We've been trying to coordinate those efforts on there, as well as identify where we can assist the other shelters on there. The homeless community is one of the most vulnerable communities for any pandemic because they're generally, and their immune systems are more compromised because they have lived on the street, and so they're more susceptible to pandemics. We recognize that, but I don't have a specific program at this point other than tell you that we're assisting our partners that provide those services.
Okay.
John, can you want to add anything to that at this point? Any needs you might have out at Grace, or what steps you're taking?
Absolutely. Thank you. John DeCarmine, Executive Director of Grace. So as City Manager Feldman said, we certainly are working with an extremely vulnerable population. Homelessness is a really interesting group of folks to be working with right now because any public health problem we can solve at Grace by preventing somebody who may have been exposed coming to our shelter would create another public health problem by preventing them from coming into the shelter and therefore putting them out into the community. So far we have suspended all volunteer programs. To be clear, that is to protect the people on our campus, not to protect our volunteers. I have generally very few people who are homeless and have recently come through airports or cruise ships. However, we've suspended all volunteer programs. We are making changes to our meal service, and beginning Wednesday, we will be doing to-go breakfasts and to-go lunches to keep people from coming into the cafe. We'll also be expanding the hours of our evening meal so that people who do come through the cafe are there for a longer, the cafe is open for a longer period of time, so we won't have the crowds that have typically been coming through, so we'll try to accommodate people that way. At this time, there's no anticipated change to the Dignity Village timeline, and overall, our goal is to continue to provide services to the most vulnerable people in this community. It is something that we have done for years. It is something that we have experience with, whether that's a hurricane or just dealing with the crisis of homelessness. There are some key questions that we need answered, and we have not yet found the answers trying to work with the Department of Health, particularly as it relates to quarantining or self-isolating. Self-isolating somebody into a home when they have no home to go to puts them by default at a congregate site. We need some kind of quarantine facility or the readiness to have that quarantine facility available. We don't have questions answered about if that quarantine facility exists, how does it work? We don't have the capacity nor the desire to enforce it, nor to provide medical services there. Elsewhere, cities have agreed to use hotels, airports, or unused buildings, including stadiums, to provide opportunities for quarantine and self-isolation. So I hope as you're looking at what you're closing down, you would consider whether some of those facilities are appropriate. We are hiring guests to clean daily with an emphasis on high contact surfaces. We've worked with the city to bring hand washing stations in that will be delivered tomorrow. Overall, we continue to monitor the situation, try to figure out what it is we can do to make sure people are as safe as possible. In terms of what we would like to see from the city, certainly we'd appreciate some flexibility to deal with the shortfall of about $50,000 a month in staff time from canceling our volunteer programs. That's mostly in the food service and cleaning areas. So we would be looking to hire temporary cleaning staff and kitchen support. We'd also need some flexibility to be able to use overtime because just like you are, we are trying to do the very best we can to take care of our team as they take care of the most vulnerable in our community. So we'll be looking at extensive, if Hurricane Irma is any indication, extensive overtime, particularly with school closures and everything else, trying to make sure that staff who are sick or taking care of people who are sick can stay home, and those who do have the ability to work can work. Most of us have a 2-week quarantine bag packed in our cars at this point, and we're prepared to stay up on the Grace campus as needed. We would love to see Grace staff and other social workers included on that fast lane for testing once that becomes available. That's something else we have not got a lot of information about. And I'll wrap up with this. There are a couple of other major steps I think the city could take to help prevent the spread of this virus, primarily working with the courts and the sheriff to prevent any further evictions from happening until this is resolved. There is a letter that is going around that has been signed on by a number of social service organizations asking for a halt to any additional instances of putting people out on the street where we're telling everybody else not to be. As you're looking at closing parks, I would ask that you keep all public restrooms open. If people do not have a place to use the bathroom, they cannot wash their hands. If they do not have a place to use the bathroom, they're by default breaking the law for fulfilling basic human functions. And once we get to the point of we have not seen any indications of coronavirus among the homeless population, but again, once we get back to that point of needing to make decisions about self-isolation or quarantining, we certainly need support from the city in helping to make that happen as quickly as possible.
Okay, thank you very much, Mr. Conway.
Mr. Mayor,
Commissioner?
I am about to conclude. I just wanted to reiterate to the city manager, please include answers to those questions and recommendations in your emergency plan. Again, I don't want us to wait for any instances. These thresholds the Department of Health had a number of thresholds that they put out, and about half of them have already been met in the number of days. And so we need to be moving very proactively. My last question is in regards to our senior citizens. I understand that state living facilities are under new direction from the governor for visitors and things of that nature, and I think that those are good restrictions. However, we have a number of privately owned facilities in Gainesville, and I want to know, in your emergency plan, are we going to be looking to coordinate with them to just ensure that they have government support to install their own restrictions, and also just in case they need support from us?
Yes, sir.
The buildings in mind, of course, I'd like to know also how Meridian is dealing with this issue. Essentially, any location where there's a concentrated population, we need to make sure we have a plan for that.
We'll certainly coordinate with Meridian, but keep in mind that they are actually outside of our geographic limits, so we can assist, but we can't impose.
Through our efforts. Very well. I would like to conclude by saying that, Mr. Mayor, I am fully in support of your decision to work with the city manager to declare a state of emergency. I am in support of the 50-person gathering curfew, 50% occupancy, and having the hours curfewed as well. I would feel a lot more comfortable with that if it were coming from the governor, however, because we can institute this in our own community, but people are going to be traveling through Alachua County regardless of what we decide. So, Mr. Mayor, if it be considerable to you and the city manager, if you all could communicate to Governor Ron DeSantis to issue his own curfews and follow suit with the leadership in New York and Ohio and Washington, that'd be greatly appreciated. Thank you.
Very good, thank you. I'm happy to do that. Commissioner Ward.
Thank you, Mr. Mayor. A number of things to bring up, but first I want to thank the manager and the general manager of GRU and all the charters who thus far have done a very good job, a commendable job in bringing plans forward and implementing things that are necessary and that look forward to some of the realities that we're going to be facing with good planning. I appreciate what you've already done and what you're about to be doing. I do support the idea of declaring a state of emergency and giving the manager authority to make sure we can move nimbly and flexibly as we need to moving forward. I want to ask again about details for testing because we all have heard anecdotes about who's available for who's allowed to be tested. We've also heard very specific numbers reported that we have. The last I heard it was 4 cases in Alachua County, and to be honest with you, I just don't think that's accurate. It's 4 cases because we don't have any testing. I'd love to believe that 4 is accurate, but I would really like us to hear so that folks at home can hear and we can all be aware, not to scare people, but so that we're all on the same page here of who actually can get tested and how and what the procedure is as of today. And I know it's fluid, and it's going to be fluid until there are enough test kits out there. But as of right now, what does testing look like?
My understanding is that testing is either done through referral by your primary care physician or the Department of Health.
Right. What that effectively means, and has been reported to me by a number of folks, is that you just don't get tested, basically. Unless you are elderly and in poor health, you just don't get tested. So,
and meet certain screening criteria in terms of just came back from a trip from abroad or are in a high-risk group or had specific contact with somebody who is no longer, I guess somebody who is not a presumed positive, but a positive.
right. So what I would like folks to take away from that is not a sense of fear, but a sense of understanding that, yes, we have at least 4 cases here, but that doesn't mean we don't have more. It means we aren't testing most people who might have it. That's important and will be important going forward. I absolutely support the idea that first responders should be at the top of the list when things become available, in addition to people with specifically compromised bodies and of certain ages. First responders, medical providers, et cetera, going down that list. Certainly other city employees, Grace and Dignity Village workers, as well as other providers of homeless services, such as Family Promise and others like that. I want those folks to be high on the list as well. But we need to remember that just because there are only 4 cases confirmed does not mean that's all there is in Alachua County, and we need to understand that moving forward. I have a question about the idea. I like the ideas of asking venues and restaurants and bars to provide by some general different guidelines to close earlier and that sort of thing. I don't like using the word curfew because I'm not sure that we have, and I'm not sure if you used it. Actually.
I did not.
didn't think
So
you did, yeah.
we are not imposing a curfew
Right.
in the city, but let me just stress, we're not asking restaurants and bars to abide by guidelines. We are mandating this action and
Yes.
it will be enforced.
Right. So how do we enforce?
We will take a 2-prong approach. Technically, a violation of an order is a second-degree misdemeanor. We will be putting teams out to be checking on the occupancy of venues And if they are in violation, we will ask them to remove people. If they decline to do that, or we come back half an hour later and the occupancies are back up, we're closing the doors.
And who are those teams? Is that codes enforcement or
No,
GPD,
that will be a team primarily between GFR and GPD
Okay.
with the assistance of code.
And the reason I talked about the word curfew, I want to be careful that we don't overburden our public safety folks with the idea of going out and telling people to go home. Right? I want to not overburden that. Let me ask about the jail, the Alachua County Jail. It's not ours, it belongs to the county, it's administered through the sheriff, I understand that. I'm concerned that once there is a case of coronavirus at the Alachua County Jail, there are going to be a lot of cases of coronavirus at the Alachua County Jail. So I wonder, from my colleagues, if we are interested in asking the court system to consider folks who are awaiting trial for nonviolent offenses doing something different with them so that they're not in a physical circumstance that pretty much guarantees they're going to get coronavirus if it comes through. Not asking people to be easy on crime, but asking if someone is in jail awaiting trial, in other words, can't afford bail for a nonviolent circumstance, what we think about that. I'd like to start a conversation about it. Mr. Manager, if you would get us a list of the parks that are closed, I don't need it right now, but just
We'll be doing that and also promulgating it on our website if
Very
it's
good.
not already there.
Very good. I want to thank the charters once again for the plan that you've put together for leave time for city workers, as well as this can't be said enough, a plan that keeps those part-time and odd schedule workers employed while this goes on, even if, for instance, we close public pools, we don't stop paying the people who work at the pools. The schools are closed, we don't stop paying the crossing guards, et cetera. That's been an issue in the past, and I want to make sure that it is not an issue in the future, and I appreciate you working on that and putting that plan in place. I do support the idea of urging the court system to slow walk evictions at this point. We don't need to create new sets of homeless folks in the next month or two, as well as the idea of keeping public restrooms open. Even though we close parks, we want people who don't have another place to wash their hands to be able to wash their hands, for goodness sake. So, Mr. Mayor, I think that concludes all my stuff for now.
Okay, thank you, Commissioner. Commissioner Santos.
Thank you, Mr. Mayor. I'm supportive of the, first I want to thank the city staff for all your work and the work that's going to be coming over the next months, and really thank our public for a lot of people are taking it seriously and doing what they need to do. I'm supportive of the measures being proposed by the city manager and the GRU manager and the proclamation by the mayor for an emergency. I would also hope that the county would take similar measures to be able to protect our residents. I think it's important that if we're taking measures inside the city limits, those measures are also being done on the unincorporated areas outside. A few update or changes I would like to make to what we did with GRU last Thursday. I would like for us to add kind of businesses as well to the ones where we're not. So no cutoffs for residential and businesses for gas, water, electricity for non-payment for 30 days. I would also like for us to add in telecommunications to that as well. The FCC has given out guidance to not shut off residents and businesses for non-payment for telecommunications. Also, and to the kind of point that things are changing quickly, during this meeting, the White House gave out new guidance on what I'll read a statement from the White House. President Donald Trump released guidelines Monday instructing Americans to avoid social gatherings of more than 10 people for the next 15 days to slow the spread of the novel coronavirus. The White House's new guidelines also advise Americans to avoid eating and drinking at bars, restaurants, and food courts, going on shopping trips, and making social visits and visiting nursing homes and retirement or long-term care facilities. So it is changing quickly. Even what we put in place now we're proposing may need to be increased, and I hope that the city manager is able to make those efforts. Thank you, Mr. Mayor.
Thank you.
In terms of the evictions, I think we should try to make some requests in that, and then also for our nonviolent offenders who are awaiting trial, we should ask to see what can be done for those.
Yeah, we can put that
Thank
in
you,
the
Mr.
letter.
Mayor.
Yeah, thank you. Commissioner Johnson?
Thank you, Mayor. And I'd also like to thank all of our staff and our charter officers for doing an excellent job with preparation. I think it's going to make a world of difference in the health of our neighbors. So I agree with all of the recommendations put forth by both the city manager and our general manager. I'd also like to support Commissioner Ward's suggestions about our jails. And I'm also wondering if is there anybody from Shands here or North Florida Regional? I think that our community just has questions about how this could be handled in our healthcare system, and I'm wondering, once the cases do happen in the jails, because they will, how will healthcare be administered in those places, in addition to what John said about at Grace Marketplace. I'm not sure how to get answers to those questions, but I'm interested in those. 2, I'm in support of either slow walking the evictions or also asking our sheriff not to enforce eviction orders. That's another step in this process. So I would be in support of and ask the commission to ask Sheriff Darnell not to enforce eviction orders at this point. 2, what I've been noticing, we're doing a really good job, I think, at communicating with our citizens, but I think that we can do a better job at communicating with our citizens that do not speak English. So I would ask our city manager and whoever else puts out communications to make sure that we're including our non-English speaking neighbors in those communications. 2, another question for our healthcare system in Shands and North Florida Regional. I think that once this does spread, there are certain folks in our population that are going to be concerned about actually getting healthcare, and that could be our immigrant population. So I think there needs to be a public declaration made by both us and also Shands and North Florida Regional and our healthcare system that getting health care, that your status is not going to be relevant to getting treatment and or government services. I think that's really important for Shands, North Florida Regional, our entire healthcare system to hear at this point, because we want to make sure that everyone gets treated if they do need to be treated. I think it would be helpful for all of us to hear from our healthcare system what the plan is if our hospitals do get overcrowded. I just think that we are not hearing enough from our healthcare system. I think that there's a lot of fear out there, and I think that it would go a long way to just hear from people about what the potential plans are. So if anybody out there is listening to this, I would appreciate that, and I'm certain that our residents would appreciate that. I'm also in support of Commissioner Hayes Santos' a recommendation about including businesses in the shutoff period, and that is what I have at the moment. Thank you.
Thank you. And just to be clear, Ms. Pilarski, in our authorization on Thursday, we included business accounts in that. I think we said to Bill, whatever you need to do, you have the authority to do, whether it's residential or residential and commercial.
That was my recollection.
Yeah, okay. Commissioner Warren?
Thank you, and thank you to the staff, the community, everybody who's been pulling together for coming together for something that we've never experienced before. I appreciate the motions that have been made, the comments that we had last Thursday in our general policy with GRUs taking time out, our support for staff who are going to be changing their jobs with the pools and Parks and Recreation. The one thing I haven't heard, pretty much all the comments that I've heard, I'm very supportive to that. I haven't heard much said with relation to our partners at UF and Santa Fe College. I'm really concerned about the encouraging students to go to other communities. I just think the more we can do to keep the students who are here, and students in any other community to stay where they are. They're not then having to go through airports or public transportation. I think it's, what we can do to support UF and Santa Fe College to keep the students local, and what we can do to help feed the students of the public K-12 system. This is a time where we talk about how do you develop that type of community that happens after a crisis. We are in an opportunity to show our better sides and to help with food, reaching out to each other while we're maintaining isolation. I mean, that's going to be a hard thing, but I think there's a lot of people available to step up and volunteer and to help. It's just really important that we maintain the services and supports to those that are most vulnerable. And again, let's try to keep everybody here. We just got word that our daughter, who just got to Zambia a week ago, to start the Peace Corps, they're sending all the kids back. And the thought of them having to go through the airport with the lines that they've got, to me, isn't the most prudent, if you look at where they are. So I want us to think about how we're trying to send people out of here when we can get them to stay and absorb them better.
Thank you. Going back to Commissioner Ward.
Thank you, Mr. Mayor. Just one thing I wanted to mention that I don't think we talked about yet. By the way, I do support. I'll get back to that. I want to make sure that our manager is in on the county emergency meetings, or that someone from the city is at those meetings. A liaison is very nice, but it's not the same thing as actually having one of our management team at those meetings. I understand that we're having daily emergency meetings here at the city, and I hope that we will be included in the county's meetings consistently.
So the next meeting that I'm aware of with the county that the city will be able to participate in is on Friday, March 20th.
Okay. I would hope that will increase to some degree. I would hope that we can work in much closer relationship. And toward that end, I want to thank County Commission Chair Robert Hutchinson for being with us this afternoon, as well as Director of the Chamber of Commerce, Eric Godet, for being here with us this afternoon. It's important that we have the community speaking as one on this issue, but I really think it's urgent and vital that the city manager and the county manager can work together regularly on this issue. Thank you.
Thank you, Commissioner Ariola.
Thank you, Mr. Mayor. I was going to raise similar points that a lot of the information that we've asked for here today was easily answerable by the Department of Health. They are working with the Emergency Operations Center, and that is housed at the Combined Communications Center, which, to my knowledge, we are a partner in. Therefore, it really mystifies me why the Department of Health would decline to be here. Moving gears, given the new White House recommendation that Commissioner Hayes Santos brought out, I think we ought to cancel all non-essential government meetings until March 30th and reevaluate at that point.
I think they have been.
All meetings have been canceled.
Yeah. My calendar certainly should look like that. Also, I have a lot of free time. Commissioner Hayes Santos, you want to ask one more question?
Thank you, Mr. Mayor. And just to be clear, we would like to meet with the county more than before March 20th and be able to those meetings. It's not us. So brought up, Commissioner Helen Warren brought up the students, and just the census is going on right now, and it's incredibly important to our community. The census has given out new guidelines concerning the COVID-19 and students being in different places, and I'll read a statement from them. In general, students in colleges and universities temporarily closed due to the COVID-19 virus will still be counted as part of this process. Even if they are home on Census Day, April 1st, they should be counted according to the residency criteria, which states that they should be counted where they live and sleep the most of the time. We are asking schools to contact their students and remind them to respond. So just make sure that even though if you are a student and you are home and you're not in Gainesville, you should be counted here in Gainesville, even though on the census form it says where are you on April 1st. The guidance from the U.S. Census is that you should be counted here in Gainesville if this is where you have the majority of your time. Thank you, Mr. Mayor.
Okay, thank you.
Mr. Mayor, on
Yeah.
that note, I do want to let you all know that we have been working with the university and the college to make sure that that word gets out. I've had a personal conversation with the Chief Operating Officer, Senior Vice President, Mr. Lane, regarding that, and he has pledged whatever support with regard to the census that they can provide, they will, because we recognize that not only is the city and the county the recipient of the dollars that follow the numbers, but the university benefits and the college benefit as well. Can I just address also the county emergency management system? So,
Sure.
so just so the commission understands, we are acting independent, but dependent at the same time. We're trying to be proactive and address the needs of our community, but we all still have to operate within the structure of the county emergency management system, which is created pursuant to statute. And so the county has an incident command. They have an emergency management operation. They have designated an individual to be the municipal liaison. We do not have a specific seat at the table. They are broken down to what they call emergency support functions. And those emergency support functions, which are staffed by various entities, including the health system, are supposed to reach out and coordinate our needs and then promulgate county-wide activities. The State Emergency Operations Center is at what they call level 1, which is the highest level. The county is operating right now at level 2, which is active monitoring of the situation. I'm not sure what threshold they will use to go to level 1, but that will be a call that the county has to make. And so we are still working. I wanted to make sure that the commission understood we are still working within the structure of the county's emergency management system. But where we are finding that our needs are not being addressed now, or we think that the policy is different, we're taking that unilateral action as we see fit.
I appreciate that. Thank you, Mr. Mayor. If I could conclude, I just want to reiterate that in the intermediate time, I would like, during our state of emergency, for the city manager to continue to press the Department of Health to answer questions. Where will the testing centers be located? When can we begin? Who will be bringing the tests, and how will they be bringing them? These are questions that need to get answered for our community as the time goes. And let me just say that right now we are at the very beginning of this crisis, and the decisions that we make as individuals, not just as a government, but also in the community, every day is going to be very important. So every day that we commit to the guidelines of the CDC, and every day we press the Department of Health to answer these questions, are literally lives potentially saved. So these are the most important days, and there are going to be hard days ahead, but we're here, and I'm very encouraged by the way our community has come together to support one another. Thank you, Mr. Mayor.
Thank you. I'd like to share some brief comments from Commissioner Simmons, who called into the clerk. So she does support reaching out to the jail and adding commercial business to GRE's plan for the disconnects and the other recommendations that have been mentioned. I also got a call from Sheriff Darnell, who said she does not support a curfew being imposed for the pressure that it would place on law enforcement for the enforcement of that curfew. I told her I'd pass that along. And then I also got a call from Charlie Lane at UF that said that their senior administration does support limiting the number of people in public gatherings, especially amongst their student population, and supports whatever means that we need to take to be able to do that. So I just wanted folks to hear that. Okay, I've written a bunch of things down that people have promoted or advocated for. I'm going to try to go over what some of those are to just get them sort of in one place at one time, and then I'll field comments or questions from the public, and then we will move to any motion from the commission. I want to be clear, the motion will not be to direct what is in the declaration, rather for other follow-up items for the city staff, for example, working with Grace to identify a quarantine facility in the event that that is needed, those sorts of things. So what I've heard that there's consensus around is for us to contact the sheriff's department concerning a suspension of eviction orders, a plan for what will happen once people test positive for corona at the jail, a letter to the courts to consider letting people out of the jail for nonviolent crimes who are awaiting trial, that we get more information on testing, when, where, how, what, why, all that. Again, follow up from the manager's office on potential quarantine facilities for a homeless population if that becomes necessary. Putting out our communications in multiple languages, especially Spanish. I think that's what mainly we're talking about. And if we have other languages, we can, especially for critical information. Getting a statement from our healthcare facilities that immigration status is not taken into consideration if they are going in for medical treatment. The GRU issue, I think, has been taken care of. I'm quite sure that we gave direction on Thursday to include commercial accounts in that. I also wanted to, in the past, we have created a special fund ID number for any spending that we do on a natural disaster, specifically in the past hurricanes, so we can account for that in the event that there is federal and state aid to help compensate us for these. So just making sure that we're
Already
doing
done.
that. Yeah, I figured it would be because it's important to have a proper accounting of these extraordinary expenses. Mr. Pilarski?
Yeah, I just wanted to clear up that I don't think at that meeting, excuse me, that it was, GRU was given direction on GRUCOM services. So I'd appreciate that.
Okay, we can include that, sure. Commissioner Johnson?
Thank you, Mayor. There's one thing that I wanted to mention that I think it's worth everybody, it's worth hearing. I was on a call last night with about 140 different elected officials from around the country about how they're responding to this. And something that the council folks in Seattle said, and they wanted all of us to hear this, is that what they'd wish they'd done sooner, absolutely sooner, was to stand up some temporary housing for their homeless population. They said that if they had done that, that it would have made a world of difference in their city. So I want everyone to hear that. I don't know how that could happen, but I think it's worth hearing that that would have made the world of difference for the spread of coronavirus in their city if they had stood up some housing for the homeless folks. Thank you.
Thank you. Commissioner Ward?
Thank you, Mr. Mayor. I wanted to, for anyone watching at home and anybody here in the room, remind you that while we've suspended disconnects from GRU, there's going to, your bill will continue to accrue. So I would urge people to, if you're in a position to be able to do this, go to Project Share, which is a service through GRU that helps people be vetted and then pay their, you get assistance with paying their utility bills through some other community groups. So please, if you are in a position to be able to donate to Project Share, I would urge you to do that. Consider it, go there and read about it if you're able. Thank you.
Okay, thank you. Mr. Manager?
I think, Mayor, you left one item off. If I recall, I believe it was Commissioner Ward that also suggested we contact the courts with regard to suspending eviction proceedings.
Yeah,
So
I thought I included that, but yeah, that's included in my list
yeah.
here. Okay. And just to be clear, these are things that we'll be making requests for. They're not things that the city actually controls, but we can contact those folks that are in charge of that and let them know it's would be helpful to us stemming the spread of this. Okay, love to hear from members of the public. If you have questions, I won't answer your questions on the spot. We'll collect those and try to answer them at the end, or if you have things you'd like us to consider. Just come up to the lectern here. And for anybody that's new here, you'll have 3 minutes. When 1 minute is remaining, a yellow light will come on that lets you know you should begin concluding your comments. Mr. Tattersall.
Mayor, Commissioners, Jeremiah Tattersall with the Florida AFL-CIO. I was tasked with reading this letter that some community members have written and signed on to, and also some of the stuff in here has already been addressed, so sorry if it's duplicated, but I'm still going to read it. This letter was sent to the Gainesville City Commission, Alachua County Commissioners, Alachua County Sheriff, and the Alachua County Board Superintendent in the 8th Judicial Circuit Court of Florida. March 16th, 2020. Dear elected leaders of Gainesville and Alachua County, we write to thank you for your leadership during this difficult time and ask that you work together to protect low-income and vulnerable members of our community while the coronavirus pandemic continues. We respect local organizations who work with people who are already marginalized in Gainesville and Alachua County in the best of times and who are at the greatest risk of harm during the upheaval caused by this virus and the efforts to contain it. Now is the time to take steps to ensure that the well-being of folks in our community who are only one missed paycheck or public benefit payment away from losing their home or being able to meet their family's basic needs. To get through this, we have to look after one another. We have to do that, and to that end, during this corona pandemic, we're asking you and your designees to institute a moratorium on the filing of any new eviction cases, both from the rental units and evictions due to foreclosures, and impose immediate stays in any pending eviction cases. It would be deeply irresponsible to require people to choose between attending court hearings and risking contamination or not attending and risking both the loss of home. Court systems and other communities have already taken these steps. See the DC court orders. Develop a local fund for emergency rent and utility assistance to make sure that families don't fall behind during this pandemic. Exercise whatever control is available to you to temporarily suspend public benefit terminations or adverse actions, including for food and housing assistance. Utilize all measures at your disposal to encourage employers to provide at least 14 days of paid sick leave, including for the purpose of social distancing and self-quarantining. To continue paying employees during the crisis, consider developing an emergency assistance fund to support local employers who are struggling to support their employees in this manner. Ensure that children who are eligible to utilize school lunch programs have access to meals throughout school closures. Extend the moratorium on utility disconnections for as long as the crisis continues. We appreciate that all this is being done already to provide support and relief during the public health emergency. We look forward to working with you further as community needs change and assistance from federal and state government become more available. Thank you for all of your work in service to our community. Sincerely, I think I'm going to need somebody else to read the rest of this.
Thank you, Mr. Tattersall. Appreciate it.
List the names.
Yeah, I got it. Sincerely, Alachua County Labor Coalition, Community Foundation of North Central. Should I have introduced my? No, that doesn't matter. Community Foundation of North Central Florida, Community Spring, Community Weatherization Coalition, Cultural Arts Coalition, Dream Defenders, Education Task Force, Fight Toxic Prisons, Florida Legal Services, Gainesville Alliance for Equitable Development, Gainesville Area Action for Environmental Justice, Gainesville Area Now, Gainesville Incarcerated Workers Organizing Committee, Grace Marketplace, Graduate Assistants United at UF. This is being edited as I am reading it. Human Rights Coalition, NAACP Environmental and Climate Justice, North Central Florida Indivisible, Open Door Ministries, Prayers by Faith Ministries, Project Youth Build, Repurpose Project, Resilience Charter School, River Phoenix Center for Peace Building, Rural Women's Health Project, Southern Legal Counsel, T. Moschel Cares, United Faculty of Florida at UF, and Working Food. I'm also from Gainesville Socialist Alternative. We will almost certainly sign on to this at our general meeting tonight, so throw that out there. Okay.
All right, thank you. Could I have the next speaker, please? Welcome, Commissioner.
Hello, I'm Robert Hutchinson with the Alachua County Commission, and I've got a great list of ideas that you guys have brought up that we're going to consider the next time we meet. The emergency declaration that I signed earlier today more or less mirrors what you all are doing. We've been focusing on county employee protection and testing, work at home issues, leave policies, and so forth. I really like what I've heard about the working with the courts and the sheriffs regarding suspension of evictions, and that was on our to-do list. But I think what we need to do is, as much as possible, parallel the things that you all are doing. So we're happy to push that. Same goes for potential homeless isolation or quarantine sites. We already do a pretty good job of jail diversion for people who would otherwise not get out because of a small amount of bail. So, but we'll look at that. Our court services department is really the front line of making those recommendations. So we'll try to push the envelope on that. Foreign language information. The county's doing a good job on our website and social media, but we are not doing a good enough job in Spanish. So I think we need to up our game there. Regarding the Emergency Operations Center meetings, there's a group that meets virtually at 8:30 Monday mornings, and that's the multi-agency partnership group. The city already is included in EOC meetings at some of the other levels. So if we need to change that, what's interesting about this is that we got a new emergency director less than a year ago, and he took the plan off the shelf for how all this emergency stuff works and redid it. And he was going to give it a dry run in March for an April rollout. So it turns out we're doing the dry run now in a real situation, and one that we didn't really anticipate, pandemic as opposed to a storm. So we are adjusting, or he is adjusting, many of the procedures kind of on the fly. So who does what? What I will say is that we have quarantined the Emergency Operations Center. You don't get in or out without good reason, and your temperature is checked and all that stuff, because we can't have our 9/11 workers getting exposed. So the county has gotten already pretty strict about our meetings are going to be online. There's a number of different apps out there, and our information technology department is working on getting everybody up to speed with GoToMeeting and Zoom and all those sorts of things.
Thank you, Commissioner. And I think just for the inclusion, we just any communications that deal with this that the city can be included on, even if they're internal, we'd appreciate that opportunity.
Great. Thank you very much.
Thank you. Next speaker, please. Ma'am, you're next. You've been like trying to get up there from the, it's, I'm going to go ahead and just make an executive decision. Wait, welcome, Zachary.
Hi there, everyone. I'd like to provide my resources and some information to address some points. First and foremost, I noticed today that there's a Facebook group, a public Facebook group called Gainesville COVID-19 Mutual Aid that was created. So specifically, it's one of those mutual aid groups that have been popping up all over the country to kind of like let people like come together to like help each other like with groceries or any type of information. So this group exists, and I think that the city has a vested interest in being in this group and making sure that the information is truthful and sharing the posts and graphics and such. So for those of you who are fortunate enough not to know me yet, too bad now. My name is Zachary Chow. I'm a student senator at the University of Florida. I also kind of like know some stuff. So for example, I wanted to also kind of like express student approval for closing the bars and restaurants and kind of like focusing on the delivery, takeout, and gift cards sort of thing. I represent the Murphy area, which is right across from Midtown, and I can tell you there's a lot of young people who are treating this as Spring Break Part 2. You have actually sent out an email to all students being like, hey, this isn't Spring Break Part 2. But yes, also the apartments with the pool party. Like I heard you say that. I'm like, which apartment pool party? Because there's a lot. And there's even this one Instagram post where someone took a drone and flew it over the apartment to show how many people were at this pool party. So definitely working with apartment housings. I don't want to be a buzzkill, but maybe we should drain the pools. St. Patrick's Day is also tomorrow, so I think that's why it's especially important to make an expeditious decision concerning the bars and restaurants. I also serve on the RTS advisory board, and while I think it's important to decrease the capacity so there's more social distancing available on the bus, I'd also like to talk about how important it is to also make sure that the buses are cleaned more than once a day. And I think that ended up in the alligator, but developing the capacity to be able to clean like midway through a shift, even if possible, it should be attempted, because if you're only cleaning it once a day, things aren't going to turn out very well. Something that I think of every single person in this room can be mindful of is high-touch services. Mayor Poe saw me stand up or raise my hand earlier because I noticed that every single person, up until the point I was like counting, had actually been touching the microphone. So in an event where like you don't want people touching high-touch services, aka when things get worse in our county, that's something you especially want to be mindful of. Like hit the elevator button with your elbow and don't lick your elbow afterwards. Finally, on the census for that Commissioner Santos brought up, totally down to help you with that. As a student, I probably shouldn't have this power, but I can unilaterally email every single student at UF information. I hope no one from administration is watching that, but I can do that and help you disseminate information. And to address Commissioner Warren's point on student movement, I saw guidance today saying that UF will be deciding if things after March 30th, which is our deadline, are going to be canceled, such as like graduation, and whether people are going to be staying later. So hopefully we'll be clearer on the student movement side of things.
Thank you, Mr. Cho. And I'm sure the administration monitors you constantly. I would take that as a badge of honor. All right, ma'am, you've been patient. Welcome.
I'm not going to touch the mic. Hi, I'm Sita Marley and I own Alpen Bistro downtown. So I want to say that first, thank you for all the leadership and all the efforts, and we absolutely support everything that's been mandated for the curfew, and we totally understand. Grace, also from afternoon, we're coming with the same questions, because we have quite a few employees. Some of them have families and children. We support local bakeries and the farms, local farms. So anyways, of course, health is number one. We both our restaurants, Afternoon and Alpen Bistro, have just made a message today that we were just going to do a takeout and people can come and take the takeout. But then I was hearing, I forget who was talking about, it was best to sit at a table than being in line. So now I'm kind of like wondering which one would be the best action to do, having people in line together or having people sitting, because we also have made that distance in the restaurant. We've taken away stools and tables are more spacious. But anyways, I think we are going to close because that feels like the right thing to do. But we also need to support our people. So in that regards, we have a few recommendations. So immediately support emergency unemployment benefits to all hourly and salaried workers during this crisis, without having to fire them, without having to wait a week for the unemployment to start. Second would be eliminate payroll tax immediately, which is federal level, but I think it's in the works. And then also a call for a rent and loan abatement for workers that are impacted by the closure of the restaurant industry. I know that personally I've already contacted my landlord and they don't care. They don't care at all. You know, we have a little cushion for ourselves. Our employees don't have any. They work check to check. I don't know if more than 2 weeks we could really sustain. So anyways, for the local economy, how are we planning to do all this?
Okay, great. Thank you.
Thank you.
Sorry, that was really loud. Mr. Mayor, Commissioners, first of all, I just wanted to thank you guys for...
Will you introduce yourself, please?
Okay, sounds good. My name's Justin Horvax. And I actually sent you guys the email this morning, and I'm here to talk to you guys today about, obviously our town has a lot of different segments and targets in it, but the thing I'm here to talk to you about is our student population and what I'm seeing at UF. And one of the reasons I put together what I did and what I sent you is because I'm scared for what is going on with our student population, because as he mentioned before, people really think it's a joke. Like they're making memes about it, like they're posting stuff on Twitter. They don't think it's that serious. And the thing is, a little over a week ago, 50,000 students that attend UF all came back from all around the world after their spring break. And after coming back from this, they are going out to bars, they are going out to pool parties, whether it's max capacity. And quite frankly, we don't know who has it yet. And that's the scary thing about this epidemic is we have no idea. We haven't had the tests. there's a chance that it could have already spread very much so in our community. And the only thing that we can do from here on out is to do whatever we can to slow that spread. And like I said, make that curve go down so that our facilities, our hospitals, when people start getting sick and need the resources, that they can actually have those and have access, so we don't have to have this situation worse than it already is. And the reason I'm glad to hear that we're doing a lot of things now, how our president had just put out that he's recommending a 15-person limit now instead of the 50 that the CDC recommended just yesterday. And there's a lot of great things, but one of my big worries is actually tomorrow, which is St. Patrick's Day. And I know, just coming as a student, I'm a senior. I have a lot of friends. They go out. They'll do all. I see them. And I know that tomorrow is the big day for them. With no school, people are treating this like a hurricane. And what they do with that, it's a week of no classes. They just go out and party. And that usually turns no repercussions. But this one could be the difference between life and death at this point in time. And I was just curious to see if I'm so happy to hear how much is going on and how much we're changing to prevent this. I was just curious, is there any extra measures that could be put in for just tomorrow to kind of combat this? Because even if we close down the bars, people are going to go to the pools. If people go have the pool parties, if they get closed down, then people are going to throw their own house stuff. You know, fraternities are going to have darties, sororities are going to have events, and that's going to enable this pandemic to continue to spread. So I was just curious to see if there's any other precautions that we could put in place for tomorrow. Thank you.
Thank you. Thanks for being here, and thanks for that work that you put into it.
Thank you.
Welcome, Mr. Shepard.
Hi, my name's Dallin Shepard. I'm People's Representative. And Jim mentioned, Mayor, that we was going to enhance a mobile van to take and address health issues. I think this would be an excellent time to do that. I think that we need to contact our president and our governors and find out where our true numbers are and where is our ask for a test kits for Gainesville, so that our city and our county can take and have tests done in our county, so that we know what the numbers are. Like these students are asking, you know, what is the truth? This is a way we can provide this truth. As a people's representative, I ask this. Thank you.
Thank you. Anybody else like to speak?
I'm going to go for that mic.
Less touchy.
Hi, I'm Kimber. I work at Southern Legal Counsel. I also come to you as a resident of Gainesville. I want to first thank you for having this meeting. Secondly, support John and his ask for keeping bathrooms open for our homeless community, especially downtown, especially throughout the community, because homelessness doesn't just exist in the Grace vacuum. So making sure that people have access to sanitation and bathroom usage is vitally important. Also, I would like to extend the reminding that we need, if you have these empty buildings, they're a great resource for having people do quarantine in the homeless community. So let's put people in safety nets. I would also like to echo what Commissioner Johnson said, and Commissioner Hutchinson said, that eviction processes don't just exist in the courts. We have enforcement with the sheriff. So if we could halt both of those, that's extremely important for preventing new people becoming homeless while we're in this epidemic. Commissioner Ward mentioning prisoners and people in jail and ending pretrial detention is super important to the sanitation of what's going on in the jail. That is going to be the epicenter of what spreads in our community. If we can get in front of it before it gets too bad, that would be vital. We don't have to be light on crime in order to do that. We can do things like diversion programs. We can do like ankle bracelets. You can do alternative forms of incarceration if that's necessary. Anything that gets people away from each other inside of those filthy, contaminated cages is necessary. But also, I think we need to, and know that that's something that this body does not have authority over, But what you do is GPD. And what we can do is stop arresting people to the height that we don't normally do by extending those diversion programs, by understanding what crimes are vital to the safety of our community and what crimes aren't. So I think that maybe I know that the Chief Jones was here, but he's no longer here. But so if you could talk to GPD and inform the public on what's going on with maybe some of that. I know that is happening nationally. That's not going to be a thing that just Gainesville's looking at. And lastly, I just wanted to say that the city manager mentioned that we are in a prevention stage and not a mediation stage, but I think that needs to be the opposite. In this meeting alone, Commissioner Santos mentioned that we are now at 10 or more. Like, we're not going to be able to get ahead of this unless we treat it as if we're already completely contaminated. We need to, like Commissioner Ward has said, our community only has 4, but we don't even know yet because people can't afford to get tested. They're not getting tested. Like, we need to act as if everyone already has it and then go from there. Thank you very much.
Thank you. Can I have the next speaker, please? After public comment. Welcome.
Mr. Mayor, thank you. Eric Godet, Greater Gainesville Chamber of Commerce, Commissioners, Chairman Hutchinson. I just want to thank you all for the work you're doing. We're very excited in our community to make sure that we are on top of everything that's happening. Our business community is very interested, concerned, and really dealing with this and having a lot of conversations with their staff right now and really looking at alternatives. Thank you for being very fluid and on top of the situation, because we know that we have to move quickly. We don't want to be one of the groups reacting and caught at the end if we could be ahead of this whole process. And so I'm just thankful for your conversation, the dialogue, and to continue to push it and encourage that. I'm thankful for Chairman Hutchinson being here and really making sure that we're aligned as a county and a city also as we move forward, because the more of us that are linked in this process and moving forward and stepping together, the less likely we're going to have as many issues later on. So I want to really encourage you to continue to push this. We, the business community, are staying alert and listening and making sure we're sharing everything you put out there, and we want to make sure on behalf of our 1,300 members and their 80,000 employees, this is really critical. It's a scary time for a lot of our smaller businesses. It's a very concerning time for a lot of our larger businesses. There are a lot of issues that people are dealing with their kids and everything else and how they handle it. And we just thank you for being proactive, because that's eliminating the need for more reactive type policies and more fear with the confidence that you're moving forward. But thank you, and I just want to encourage you to keep pushing and don't slow down, and you have the community support to make sure we're addressing this issue. Thank you.
Thank you, Mr. Godet. Anybody else like to speak? Mark?
Great use of plastic bags. My name is Mark Van Soesbergen. Hi, yesterday I was in Daytona visiting my sister and stopped by the Iron Horse Saloon. And the whole thing about, to them anyway, the whole coronavirus, it's like we're taking away their guns or something. And so there's, they're not liking this at all, like it is an invasion of their rights or something. So that made me think that there's layers to this whole thing. And, you know, some people are going to be in stage 4 of understanding, and some people in stage 2, and some people are just learning about it. Anyway, that was sort of my take at the time. And I know nothing really about this stuff, but I did see a couple of numbers, and one was like, if there's 4 confirmed, there's probably like 20 out there, kind of what Mr. Ward said, Commissioner Ward said, and then with the ratio of our population, the county gives us 1 in 10,000. So when the confirmed comes to 40, there's probably 200, which is 1 in 1,000. And then what you don't, you want to stay around there. You want to stay around like 40 confirmed, let's say. And then what you don't want is to be at the 1/100, you know, where you have 400 confirmed, because it means you have 2,000, you know, out there that don't know they're sick yet. They're having corona light, and they're just walking around, you know, they don't know. They have no idea. So, and that's the 1 in 100 is sort of where you end up in a sort of an Italy situation, and people are, you know, seeing operas from the balcony because you really can't afford that risk anymore. So if you could stay it up there, that's good. What it really means is that you have a whole bunch of people that are, you know, senior citizens here, and we should bring them their food. You know, whether they do the call in, and there's a shopping cart outside of Publix with a phone number on it, and pick it up and drop it off at the entrance of the atrium, and we should be able to do that. That's just logistics. That should be easy. And maybe we should start training that now. So whether it's 352 delivery or we do it as a volunteer thing or however we come about, maybe using, forget the gentleman's name, but maybe, the students that have scooters and bicycles and whatever and can help out in this kind of event. The other one was that we have telecommunications. If this thing actually, if you look at the perspective, like China started actually first occurrences late November, and now you see the timeline brings you to 5 months. So for us, it could mean August-ish, kind of, when you think about it, before we really feel comfortable and it's burnt out, if you will. So that means our kids, could we use the infrastructure that we have for them to maybe use, maybe we give them, can we wire up, in my idea, East Gainesville first and give them access so they can study from home, basically provide that kind of communication infrastructure to them, if that's possible. Because now it's still kind of a holiday kind of feeling, but in a few weeks, moms are going to be wondering what to do with these kids. And if we can use our ability and the infrastructure that we already have in place to provide a resource for them to study and be occupied in the daytime, I think it would help.
Thank you, Bart.
You're welcome.
Can I have the next speaker, please?
Could I have the overhead, please? Before I came here, I was at Walmart doing some shopping, and you see a picture here. This wasn't from our Walmart. I was in California for a week, and that shelf was full when I was there. I got that from my son last night. I'm sure that's going to happen here, and in Walmart, there was no toilet paper, none, no hand wipes, nothing. I don't know what it's like in the other stores. But it would surely be a help to the community if those kinds of pieces of information could be given to people. I don't know if I never even thought about it till today when I got that call last night and saw this picture of something. I just thought, well, we're replicating where somebody else is first. And not anything that the city commission could necessarily do about it, but not to panic, but to kind of plan and know what you're going to need and what you're not, and maybe put a little bit less burden on the system. Not hoarding, but buying your groceries, having them put aside, and maybe everyone's got an app that tells you when there's gas that's out. Maybe people could do something with food. I don't think it's an issue now, but as I was there, I could see more and more anxiety picking up, and if that's happening now, I imagine it's going to happen more over the next few weeks. Thank you.
Thank you. Anybody else like to speak? Okay, let's turn back to the commission. We'll move towards a motion. First, we have Commissioner Ward, then Commissioner Warren.
Thank you, Mr. Mayor. The conversation brings back a few other ideas, brings up a few ideas. When we talk about small business insecurity, particularly restaurants, I spoke with 2 other restaurant owners in the last couple of hours before this meeting. It's going to be extremely difficult to remain open. I hope that in some cases you'd be able to shift to pickup or delivery. But we can't do anything this afternoon, but I would like to task the city manager's office and all of us with seeing what ideas we can come up with for considering small short-term loans and that sort of thing. We do some business activity for startups. Maybe we could shift some of that thinking toward sustaining the existing business community. And again, that's not something we can make a decision on right now, but we could certainly task folks with having those conversations in the manager's office. I love startups. It's a great idea to go try to start new things, but we need to keep our current community in good shape so that they can continue to pay people. In the meantime, I'm talking to you if you are a landlord. Please consider both residential and commercial leases. We talked about talking to the courts about slow walking evictions. I'm talking to you as landlords to please consider thinking about things before you start an eviction process at this point. I know that's hard on landlords too. I understand that it affects everyone, but let's all try to work together on this process. Speaking of food, though, I was, some of others may have been as well, but I was contacted by the NAACP in the last few minutes. about the idea of, we know that food is available at schools as a carry-out sack lunch sort of thing, a sack breakfast in many occasions, but some folks don't have transportation to get to those school sites to do the pickup. That's another thing I would ask that we consider, how we might be able to help with that. And that's a right now sort of thing. So unfortunately, we're not going to meet again. But if the manager's office could think on that to some degree, and if all of us collectively could work on that, that would be especially helpful to some folks. Mark talked about broadband to areas of the community that are not served by broadband. That is going to be a big deal. Again, right now it's spring break. Kids are excited to be home. They're going to need to continue to learn, because I don't think school's coming back in 2 weeks. I could be wrong, but I don't think school's coming back in 2 weeks. So the more we can do to make that either through GRUCOM or our partners at Cox Communications stepping up to provide those services in conjunction with the Alachua County School Board, that is going to be vital to large groups of kids in our community remaining engaged and learning when they are not able to be at school. There's so many things we could talk about on this. There are some more food for thought, and hopefully we can work together to solve these things. Thank you all for being here today, and anyone at home for watching, and to my colleagues and staff for remaining engaged and working to solve this all. Thank you.
Thank you. And I know the manager's team's been in discussion with schools since Saturday about food distribution, so that they're expanding the areas they're offered in, and the opportunities to get that. Commissioner Warren?
Thank you for another opportunity. And yeah, the conversations that we had during citizen comment, I want to go to your comment in particular, because again, across the country, there's a lot of discussions about how to deal with St. Patrick's Day, and many communities are trying to shut those events down. I feel that we could I had hoped that we can have a connection with the university and their ability to send out messaging to all the students, but I would put that as a priority of what needs to get started on right now, so that the kids there's advertisements for public bar crawls, what do you call it? Tomorrow's supposed to be a big day, 2 o'clock to 2 o'clock in the afternoon to 2 o'clock at night, to get the students out and do a bar crawl. And that's going to really impact what our police officers and the first responders are going to be able to do. I think it's really critical that we make a point of having a conversation with Charlie Lane, if you're out there, and all the UF and Santa Fe College student services to support a heads up and try to divert that activity. Thank you.
They're 100% supportive of that. Yeah, I've talked with them. Commissioner Ariola?
Thank you, Mr. Mayor. I have a question for the Assistant City Manager. After the emergency, you are the one in the room. After the declaration of emergency is signed, do we have police authority to break up large gatherings of individuals
So this evening,
on private property?
So code enforcement and GPD are prepared this evening once the declaration goes into place, and once we've developed the appropriate guidance. They're going to be going door to door to businesses this evening to provide the necessary guidance and warning for them and what the restrictions would be. So and then over the next several days, we'll be going to as many businesses as possible and distributing that information. As the city attorney referenced earlier, this is a second-degree misdemeanor. The intent currently from the city manager is that they would be given a notice of violation, and if they cease to do that, then we would take the appropriate actions to shut down the event.
Does this also take into account apartment complexes, fraternity homes?
So this would apply to certain types of assemblies or buildings with assembly capacity. So we are developing the specific language now to make sure it's tailored to be narrow and targeted on specific businesses where these could occur. I can't speak at the moment as to the specific, if it's going to be individual residences. I think initially it's going to be focused on businesses, including gyms, theaters, restaurants, bars. We're
we're working with the city attorney to develop the appropriate language. That's something that's still in development right now.
Okay, Mr. Mayor, I would be very interested in seeing that language when it's completed, because I think that we ought to have the ability to break up large gatherings of people, even if it's on private property, whether it's at a pool party, whether it's at a fraternity house. I understand that the university has something to say about some of those. I will be reaching out to the Panhellenic Council after this meeting to instruct them very much to follow the CDC guidelines, because I understand that they have a governance structure that's there as well. And I'll say this about St. Patrick's Day. Originates from Ireland. Ireland is closing their bars tomorrow. So if Ireland can sacrifice St. Patrick's Day, I think we can here as well, for the public good. Mr. Mayor, I'd like to hear your list of items once again to include into a motion so that we can get everybody out of here.
Yeah, I'll go back to that. Commissioner, did you have some added information, or one of you? You looked like you had something to add to the conversation. You too, Adrian?
The Gainesville City Manager has been added to the MAC list, which is the one that meets Monday mornings and Fridays by phone. So he's getting the invitation. And I quizzed the sheriff, and I'll just read her response to the evictions. My question, what authority do you have to unilaterally suspend evictions during a declared emergency? And her answer was, I have no authority to suspend evictions as I'm bound by law to follow judicial orders. This is a matter for the court administration and chief judge, so we'll be following up with them.
Okay, thank you. Adrian?
Thank you, Mayor. One other thing I would like for us to add is to ask Cox Communications to remove their data caps. Most ISPs around the country have already taken that action, and with the data caps on there, you start to pay a lot more when you're hitting that, and I'm sure with everyone being at home all the time, that's going to happen. The question about takeout seating versus being in, so takeout is the best. The reason we're putting in kind of the seating requirements is to, if you are going to stay open, to have that separation and not have people standing or at the bar. So if you're doing takeout, that's the best thing you can do, and to not have people in a close quarters. And to the point about large gatherings, even in the street or on private or pool parties, I think we should, in our declaration and in our enforcement, enforce those as well to ensure that we don't have large gatherings know where they are. It's a public health emergency. Thank you, Mr. Mayor.
Thank you. Okay, so thank you all for your assistance and input. What I heard from the commission and some things added by the public that the commission added was that we send a letter from me to the jail asking them about their plans once the virus is detected there, that we contact court services and the sheriff, asking them to suspend conviction orders, that we ask for clarity from the health department on testing, when it will be available, what the procedures will be, that we contact the Panhellenic Council, encouraging them to request their members suspend large gatherings, that we contact Cox Communication and ask them to remove data caps. So those are sort of external organizations that we'll be sending letters to requesting to take action.
Also follow-ups with the senior living, private senior living homes.
Requesting what?
To reach out to the private living facilities for seniors.
To do what?
For coordinated support in the event that they need.
Oh, okay. I think we're doing that. Yeah, Adrian. I think we're already doing that, but yes, we can send a letter. Oh, we've already done that. Yeah, it's all right. Yeah, I already talked to Charlie. Yeah, they're very supportive of that. They actually contacted us about telling us they support minimizing that. Yes.
On Cox, I asked them earlier today, and they just got back to me. They will be overage charges are on hold for at least 60 days.
Okay.
So for the data.
Okay, so we don't have to send that letter. Okay. And then asking our staff to allow for public restrooms to be available during normal times of the day for sanitary reasons, to start working with and identifying potential quarantine sites in case the need for our homeless population becomes necessary, that we look for more multi-language communication, especially Spanish communication of critical information, that we make clear that commercial customers being included in the GRU action taken last Thursday, as well as GRUCOM customers. I don't think we can ask our staff to look for how we can assist with local employment challenges. I think that everything that was recommended is a state or federal action, unemployment benefits, payroll tax, and some of the other things, but we can certainly work on that. And then, yeah, we'll do a coordinated communication between the city and UF on discouraging any public gathering of more than 10 people.
Mr. Mayor, I move those recommendations.
Okay, is there a second? Motion is second to move those recommendations. All in favor of the motion say aye.
Aye.
All opposed? That motion passes unanimously. I think. Can I get you all over there? Was that an aye? All right. Okay, thank you all. We now have an opportunity for general public comment. Any items not on our agenda? Anything not related to COVID? That was on our agenda. If you want to follow up with me afterwards, you can. Any member comment?
Thank you, Mr. Mayor.
Okay, y'all be safe. I want to remind everybody we have a telephone town hall meeting Wednesday at 6:45. It's open to anybody. You can call into that. We'll answer more health-related questions, and we'll have some experts there. And then, if you would, just try to stay away from each other. As much as we love each other, let's try to stay away from each other. This meeting is adjourned.